Welcome back into Good Morning Arkansas. We're starting a monthly segment here on Good Morning Arkansas, and to do that and to help us out, we brought in Dr. Scott Davis from Baptist Health. He's going to be talking about some of the different things to watch out for in your health and in your world. And Dr. Davis, we really appreciate you coming on here.
Thanks, Chris.
And starting this off with us.
Good to see you.
We're starting with something that's very important that affects a lot of women out there and men as well, but certainly it's deadly, and it's coronary artery disease. And there's a lot of risk factors that play into that. And I know you guys have some different preventative measures as well, but let's talk about some of the risks first of this disease.
Yeah, so coronary disease affects a significant number of our population. And so the first order of business is to identify one's risk. And there are basically 6. Men typically get coronary disease more commonly than women. Folks with high blood pressure, high cholesterol, smokers, diabetics, family history of heart disease. Now it becomes pretty evident which ones we can control, which ones we can't. You can't pick your parents, we can't change your genetic predisposition, but certainly for smokers, we want to get you off cigarettes. If you're a diabetic, get your blood sugars under control, bring your cholesterol under control, and certainly keep blood pressure within a reasonable, manageable range.
Some good tips there. I know we have some video to show as well. What exactly is this diagramming?
So we're watching a video diagram, an animation of the way cholesterol plaque builds up in the artery. The red pipe is a heart artery, and over time cholesterol plaque can build up and begin to occlude the artery, the lumen of the artery, so the pipe gets narrow. A cholesterol plaque has a soft inner core and a fibrous cap that then can progress. Now if that fibrous cap cracks, then we can form blood clot as illustrated here, and then that is what then causes a heart attack. So what we want to do is keep that from happening by getting your cholesterol under control. It then targets that soft core and makes it more stable, less likely to rupture, less likely to form blood clot. And this is just illustrating then what a heart attack might look like, where part of the heart muscle, part of the heart tissue is not getting enough oxygen. And it happens abruptly, so that the plaque will develop over a period of years, decades, but then when that plaque cracks and it all of a sudden allows those platelets to get sticky and clump together, that forms the heart attack. That's what we want to try to target. That's what we want to try to avoid. And by getting our risk factors under control, that directly impacts one's chances of not having a heart attack, of not having progression of heart plaque like that.
Some important things to help prevent that as well. We look at something like a heart attack, which is so spontaneous for so many people. You could never see it coming. They exercise every day. They eat all the right foods. But knowing your cholesterol, as you mentioned, is so important. Are there any symptoms out there that one could watch out for before they actually have a heart attack?
Right. The typical textbook symptoms of coronary disease, where there's compromised blood flow to the heart tissue, is heaviness, pressure, tightness. Usually, if you can point to the symptoms with your finger, yeah, it hurts right here, doc, that typically is not angina, typically not cardiac. It tends to be more diffuse. It tends to be generalized in the chest, and often will move up into the shoulder, up into the neck, often worse with exertion, going up a flight of stairs, bringing in the groceries, going out and doing lawn work, often gets better with rest. But anytime you have symptoms of chest discomfort that don't go away after a couple of minutes, in other words, somebody's getting on your chest, it feels like somebody's just pushing your chest, you need to go ahead and call 911. Don't wait for it to go away. Typically what happens as we have symptoms is we think, oh, well, I'll just sit down and be still and it'll go away. But if your symptoms last more than, say, 3-5 minutes, you need to go ahead and act on that and call 911.
So important, it could end up saving your life.
Indeed.
Real quick, let's talk about, you said, it's very common in both men and women. Anyone can get this. We talk a lot about different diseases that affect women, but this could actually be more deadly than all the others.
Correct. If you look at just all the disease processes that affect women, and I say this very often, for as much emphasis as we put on breast cancer and breast cancer awareness and Susan Komen and Race for the Cure, more women will die from coronary disease than from breast cancer. That's not to disparage or put breast cancer on the back burner. It's just to emphasize that we really want to make a concerted effort to focus on women and women's risk for coronary disease.
Glad that you guys are here to talk about some of these measures and some treatments as well. Let's real quick talk about what you're going to be talking about next month, and that's stents.
That's right. So let's start talking about the way we treat coronary disease if it develops. And one way is to treat it with stents, which is the least invasive way to open up an artery. It's where we go through the leg and can deploy a stent, scaffold open the artery. We'll talk about that in more detail and shed some more more light on that.
Fantastic. Dr. Scott Davis, thank you so much.
Thanks, Chris.
Coming in here, telling us more about the coronary heart artery disease, and we'll, of course, talk more about stents next month with him as well. Be back with more from the River Market on Good Morning Arkansas right after this.